Hello guys, welcome to Unique 5. In today's video, I'm gonna talk about 5 important ways to slow the spread of coronavirus. So let's get straight into the video. Number 5. By wearing a mask. You should wear a mask over your nose and mouth to slow the spread of coronavirus. You could spread COVID-19 to others even if you do not feel sick. A recent study published in Health Affairs, they compared the COVID-19 growth rate before and after mask mandates in 15 states. It found that mask mandates led to a slowdown in daily COVID-19 growth rate by 0.9% compared to the 5 days prior to the mandate. Another study looked at coronavirus deaths across 198 countries and found that those with cultural norms or government policies favoring mask wearing had a lower death rates. Even if you live in a community where few people wear masks, you would still reduce your own chances of catching the virus by wearing one. Number 4. Maintain physical distance. Physical distancing means put 6 feet of distance between yourself and people who don't live in your household. Remember that some people without symptoms may be able to spread virus. Keeping distance from others is especially important for people who are at higher risk of getting very sick. Avoid crowds. Being in crowds like restaurants, bars, fitness centers, or movie theaters put you at higher risk for COVID-19. Avoid poorly ventilated spaces. Avoid indoor spaces that do not offer fresh air from the outdoors as much as possible. Number 3. By washing your hands. Hand washing remains one of the best ways to prevent the spread of coronavirus. Proper hand washing not only reduces the spread of coronavirus but also reduces the spread of other viral illness such as cold and flu. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. Avoid touching doorknobs, toilet flush handles, and faucets after washing your hands. Try using a paper towel or gloves to protect your hands and fingers against germs. Number 2. Cover coughs and sneezes. Always cover your mouth and nose with a tissue when you cough or sneezes, or use the inside of your elbow, but make sure you do not spit. Throw used tissues straight away in dustbins. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol. Clean and disinfect. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, handles, desks, phones, keyboards, toilets, faucets, and sink. For cleaning them, use detergent or soap and water prior to disinfection. Number 1. Monitor your health daily. Be alert for symptoms. Watch for fever, cough, shortness of breath, or other symptoms of COVID-19. Health monitoring is very important for people who are running essential events like going into the office or workplace and in settings where it may be difficult to keep a physical distance of 6 feet. Take your temperature if symptoms develop. But don't take your temperature within 30 minutes of exercising or after taking medications that could lower your temperature like acetaminophen. As the virus that causes COVID-19 began to spread from person to person in communities, scientists needed to track the disease and try to slow its spread. To do so, they needed a common definition for cases of COVID-19. Having a case definition helps to make sure cases are counted the same way everywhere. As COVID-19 becomes a nationally notifiable disease, meaning that health departments are required to report cases of COVID-19 to CDC. This helps the agency to monitor the trends in cases within the cities and across the countries. Thanks for watching. Please subscribe my YouTube channel and press the bell icon to never miss an update from Unique 5.